Ladies and gentlemen, please take your seats. The 2013 CEO Awards of Excellence are about to begin. Sit back and enjoy. Please, no talking, no texting, no cardiac surgery. And now, please welcome your Master of Ceremonies, Dr. Oscar Howell.
So welcome to the third annual Eastern Health Employee Recognition event. It's my pleasure to be here once again, serving as the Master of Ceremonies for this auspicious event as we celebrate achievement and recognize excellence in our organization. It's good to be different venue this year. Actually quite exciting to be here. I never dreamed I'd be up here or at something called Oscar for the Oscars, but I do think I'll keep my day job, I hope. So we had a lot of fun making this video, but I'll tell you it's as much fun coming to an event like this to celebrate you folks and the achievements that you've had. On behalf of the entire leadership team at Eastern Health, we want to tell you how proud we are of our staff, our physicians, our managers, because we know you make a difference every single day. And a special congratulations, of course, to the 60 individuals and teams that were nominated for the CEO Award of Excellence. The number of nominees is a testament to the depth and breadth of the talent that we have here at Eastern Health. You know, for me, there's many ways to be nominated, but to be nominated by your peers is very special because they're the people who see you work every day and know the contribution that you make. So we're pretty proud of all of you, and I hope you're proud of yourselves. So let's begin the afternoon with the presentation of the Lighthouse Grants for Innovation. Lighthouse Grants provide up to $10,000 to support innovation and encourage new approaches to our work at Eastern Health. I'm trying to find the right place for this mic. The awards were first presented in 2007, and after today, 46 grants will have been awarded for a total of just over $390,000. Here to present this year's grants to the successful applicants is Carmel Turpin, Vice President with responsibility for the grants program. Carmel?
I probably don't need a mic. Thank you, Oscar. I just want to take just one little second to say, I remember we were at the breakfast that the President and CEO hosts for the winners every year at last year's breakfast, and we were talking about how do we top what we saw last year. And I think I have to hand it to the group that I think, again, we've seen another exciting opening of our event. And I'd certainly like to recognize Susan Bynell, who's the creative spirit and director behind what we've seen here today. And with the support of the corporate communications team, who were your paparazzi as you walk through. And of course, the members of the recognition committee. I think, again, this year they certainly done me proud as the vice president responsible for the corporate communications program. Awards such as these provide a great opportunity for individuals and teams to demonstrate Eastern Health's values of excellence and connectedness. As Oscar indicated, the purpose of the Lighthouse Grants is to support innovation that will encourage new approaches to the work of departments, programs, divisions, professional groups, and teams. Innovation can be defined in any number of ways. The introduction of something new, a new idea, method, or device, change that creates a new dimension of performance, or a new idea that needs to be implemented. Innovations that emphasize projects that impact on patients, clients, and resident care, or well-being and the well-being of healthcare workers are particularly welcome. The Lighthouse Grants for the Innovation Program was introduced in 2006. Many of the initiatives that started with a Lighthouse Grant have had significant impacts on the care and services we provide. Some of the grants awarded from that first year are still continuing to this day, and some have evolved into provincial initiatives, such as an educational program for the prevention identification, and management of eating disorders. Some innovations, such as a resource manual developed for parents of children with cleft lip and palate, have been requested by other healthcare providers from across the entire country. Innovation that results in knowledge transfer is always positive. Yet most importantly, these grants have advanced and enhanced the work of Eastern Health. For example, in 2010-11, the Wheelchair Skills Program started a formalized approach to wheelchair skills training for trainers and manual wheelchair users. Cindy Lloyd, a physiotherapist who works with the program, told us that a wheelchair skills training workshop was hosted at the Leonard A. Miller Center in October 2011. Physiotherapists and occupational therapists from the Rehab and Continuing Care Program and from the Janeway Children's Rehab attended. Cindy says, the course was very practical and clinically relevant. Each participant had the opportunity to practice each of the 32 wheelchair skills, and the value of this practical learning experience was enormous. She goes on to say, I personally work with adults with neurological conditions such as stroke, spinal cord injury, and traumatic brain injury, many of whom will be new lifelong wheelchair users. So I will use these skills on a regular basis and see the impact they make in lives of wheelchair users and their caregivers. A Lighthouse grant to introduce lean initiatives in the laboratory has had similar impacts in terms of long-term learnings and improvements. This project introduced new concepts of waste management, balanced production, and process improvements to the lab and has greatly improved the relationship between the lab and other programs and departments. Most importantly, as Gerald Howard from Management Engineering puts it, the culture shift in the lab has been positive. Innovative ideas that result in culture change, that's pretty impressive. And it's wonderful that the Lighthouse Grant Program is part of that success. In another Lighthouse Grant Program, the staff of the rehab program partnered with the new YMYWCA to offer a community-based fitness and movement program for people with a neurological disability, clients with stroke, brain tumor, Parkinson's disease, and MS. According to physiotherapist Jennifer Shears, the project was the first of its kind to be introduced in the community, and it provided another option for clients with neurological impairment to feel comfortable and safe exercising in a community gym. Jennifer says, great things are happening with this, and we are presently in discussion with the YMCA about the potential hiring of a part-time physiotherapist, a first ever, to continue running this program at the YMCA with the support of volunteers from the Human Kinetics School at Mon. We certainly hope that this year's innovative ideas yield such high rewards as some of our past recipients. All grants are reviewed by the Lighthouse Grants for Innovation Review Committee, which has broad regional representation. Applicants are advised to review Eastern Health Strategic Plan, organizational values, and departmental operational plans to ensure the innovation being proposed is consistent with the direction of the organization. To ensure we are keeping track of successes and areas where projects didn't go as planned, recipients are required to submit an evaluation within 16 months of receiving the award. So who will be reporting on success in the future? Who are this year's innovation leaders and agents of change? It's now time to announce the recipients of this year's Lighthouse Grants for Innovation. I am pleased to say that there are 3 grant recipients this year. Our first grant this year is in fact related to the Lean Initiative. Rick Abbott, Regional Pharmacy Manager at the Dr. H. Bliss Murphy Cancer Center, has been awarded $10,000 for an initiative to improve safety and efficiency and ultimately reduce medication errors. Rick's project, entitled Safety, Efficiency, and Innovation in Oncology Pharmacy, engaging frontline staff in practice change, utilizing human factors and lean methodologies, involves workshops to frontline oncology pharmacy staff on lean and human factors methodology, process mapping, and improved workflow measurement of efficiency pre- and post-intervention, and internal and external dissemination of the findings and recommendations for successful implementation in a variety of environments. Rick, please come forward to accept your grant.
I will keep this very short and sweet. This is not about one person. This is a team, I guess, application. So I know Dean McIsaac is here, also lovingly known as Lean Dean. So if Dean could stand, he's a part of this team, and Denise Chant from Quality and Safety. And none of this would have happened without a great idea from Catherine Chubbs. And I don't know if Catherine's here, but I'd like to acknowledge Catherine as well. Thank you.
Our second grant this afternoon goes to an individual who also received a grant last year. Congratulations to Dr. Susan McDonald, Regional Medical Director for Palliative Care, for her submission on early palliative care intervention in lung cancer patients. Dr. McDonald will use her grant in the amount of $7,100 to implement a new triage system and intervention for all patients newly diagnosed with lung cancer at stages 3B or 4. This system will assist in determining which patients are appropriate for immediate referral to palliative care. The funds will be used for an internet application and to set up monitoring of all patients, development of new protocols for implementation, and development and printing of new pamphlets. Accepting the award on behalf of Dr. Susan McDonald, who was unable to be here today, is Carmel Collins, Nurse Practitioner, Palliative Care Program.
I just want to say thank you on behalf of Dr. McDonald, who's out of the province. Otherwise, she would certainly be here to accept this today. We're very pleased with receiving the award, and we really see this as helping us move this initiative forward to help enhance the care we provide, particularly lung patients with cancer here at Eastern Health. So thanks very much.
It's not very often I come face to face with another Carmel. Bit unnerving, to say the least. Our final grant goes to a team who are planning a video to support safety education. Janice Dalton, Regional Coordinator for Long-Term Care, and Connie Pilgrim, Regional Social Work Coordinator for Long-Term Care, will receive $9,000 for Your Role in Safety video for residents and families. Building on existing resources and promoting the resident and family as members of the team, the long-term care program will develop a 30-minute video highlighting important standardized safety messages and will be available on the Eastern Health website with hard copies of DVDs available at the nursing home sites for distribution through venues such as resident family council meetings. Please join me in welcoming Janice Dalton and Connie Pilgrim to accept their grant.
Just like to thank the committee and the organization for the opportunity to move forward on this initiative. Thanks.
So congratulations to all the grant applicants and winners, and I encourage you to apply next year. Who knows, your creative idea may result in sustainable change in our organization. I also want to take a moment while I'm up here to comment on recognition. This week is the time of year we have set aside for our more formal acts of recognition in our organization. However, I know all of you in this room today can acknowledge that recognition is and should be happening in our organization every day. As an example, I want to share with you a story that was shared with me a couple of weeks ago. It was late on a Friday afternoon, and as many of you know, Fridays in our organization aren't usually days that, everything will go well. And if anything is going to happen bad, it's usually going to happen on that day. In my world, that is, I should say. It was to my delight, though, that I received an email from Jim Brown, the Director of Health Information Services and Informatics, one of the programs that I have responsibility for, who had forwarded to me an email thread in which a casual call-in clerk at the Dr. G.B. Cross Memorial Hospital in Clarenville, Michelle Halfyard, who took it upon herself to send an email to her manager, Marina Fry, to let her know what she thought of her co-worker, Peggy Blunden, the full-time booking clerk at Dr. G.B. Cross. Michelle had been filling in for another worker in the booking office. Michelle described Peggy as one of the real wonderful people working in the department. While it is a busy place and they are constantly dealing with the public, Michelle said Peggy was considerate to her co-workers and is so pleasant to the public. Each morning when Michelle arrived at work, Peggy had a cup of coffee waiting for her. And because Michelle has children, Peggy agreed to change the hours of her regular shift so Michelle could come in at 8:30 rather than 8 o'clock. I want to commend Michelle for taking the time to send that note about her co-worker to her manager. We should all do more of it, and I want to commend Peggy for creating a positive work experience for Michelle and others in the department. Well done, Michelle. Well done, Peggy. Our recognition leaders are throughout our organization. Thank you.
Take pride in our accomplishments, 2012-2013. Access and Privacy co-sponsored Privacy Awareness Week with Health Information Services and Informatics, completed over 4,000 confidentiality oaths and affirmations, and facilitated Personal Health Information Act education for over 5,000 employees. The Allied Health Professional Practice Department had 180 high-quality student placements across 8 allied health professions, started a 12-month pre-doctoral psychology internship program with 4 interns, and developed and implemented the Allied Health Professional Practice Consultation Framework. The Ambulatory Care Department used lean process improvements, introduced tele-ophthalmology programs in the Burin Peninsula Healthcare Center, and redeveloped and relocated the adult insulin pump clinic to the Majors Path Diabetes Center. Cancer Care consistently achieved national benchmarks for access to radiation services for newly diagnosed cancer patients. Tele-oncology service was deemed a leading practice nationally, and the program installed TrueBeam STX technology. The Center for Nursing Studies graduated 120 BNs in 2012. 117 graduates are expected for 2013. 39 LPN graduates and 6 new nurse practitioners. And 180 registered nurses and LPNs enrolled in continuing studies. Children and Women's Health brought more OB program for labor and delivery to 4 sites for obstetrics in the region, reducing the C-section rate from a high of 36% to 29% this past year, and decreasing postpartum hemorrhage from 138 to 118. Clinical efficiency in collaboration with orthopedic surgery decreased the number of longest waiting patients for hip and knee replacement surgery by 40 cases, and they've started the implementation of an organization-wide process improvement using the lean philosophy for real-time demand capacity to improve patient flow. The Aboriginal Patient Navigator program was presented as a best practice at the Health Council of Canada's National Symposium on Integrated Care. In community supportive services, the eligibility assessment was adopted as the provincial standard by the Department of Health and Community Services. They implemented the social worker generalist model across the region. Corporate communications managed a 30% increase in media inquiries, opened new Facebook and Twitter accounts, and produced award-winning communications plans and tactics. Diagnostic Imaging did the first neural coiling treatment for cerebral vessel aneurysm this year. They also installed the third MRI scanner for Eastern Health and significantly reduced wait times for access to MRI, CT, and ultrasound. In dietary food laundry for Aramark Healthcare, new quality and financial variance scorecard systems were adopted. All managers received national certification in safe food handling practices. The Emergency Paramedicine Program started the ED Access Project. Meditech Emergency Registration and Discharge System is currently in the City and Peninsula site, with rollout to rural Avalon in the coming weeks. They implemented Voicera, mobile communications devices, and lean processes at the Health Sciences Center, and recruited a medical flight team for Happy Valley Goose Bay. The Employee Labor and Relations Department supported professions through newly legislated processes, reduced grievances filed to 499, the lowest number since 2008 and 9. The Environmental Services Department reduced the cost of transportation, treatment, and disposal of biomedical waste, which will result in approximately $670,000 in savings a year. 50% of their staff have first aid at Central Laundry, and 94% of the staff have completed workplace violence awareness. Financial Services successfully converted to the new public sector accounting standards and consolidated billing accounts receivable as part of the Meditech module for Peninsulas. Health Information Services and Informatics led the integration of the Peninsula's Meditech system in collaboration with HTDM and incorporated 148 physicians into the process-enabling speech recognition process. Health Promotion launched Before You Are Pregnant, developed the Regional Health Promotion Plan, Working in Health Promoting Ways Where We Live, Work, Learn, and Play, and facilitated Population Health Day for allied health professionals. Healthcare Technology and Data Management implemented the Iatric Security Audit Manager, called SAM, to protect patients' privacy by monitoring and querying Meditech, and implemented Voicera wireless communications in the emergency department. They also implemented Meditech Data Repository to expand our reporting capabilities. In home and community care, 100% of home and community care nurses completed med reconciliation education. The initial chart audit shows a 91% compliance with standards. They expanded the home IV therapy program to Holyrood, Hartstillite, and Whitburn, and launched the Chronic Disease Prevention and Management Strategy. The Human Resources Client Services Department led the management classification review process for 524 positions and introduced eRecruit, an online job board and application system. And Human Resources Program and Policy Development introduced LEADS and offered 2-day Leading in a Caring Environment workshops. They conducted the 2012 Employee Engagement Survey. Infrastructure Support is leading the design construction for PET-CT, the largest capital project we have ever attempted. And they managed multiple renovation and construction projects at the Janeway, Carbonear, Western Bay, and St. Clair's. In infection prevention and control, comprehensive hand hygiene audit was completed. Dr. Natalie Bridger and Brenda Earls received Moira Walker Memorial Awards for international service through Team Broken Earth. The department also hired an epidemiologist who will enhance surveillance activity reporting. In laboratory medicine, OLA accreditation was achieved for all labs. They installed over 60 new hematology, biochemistry, and coagulation analyzers, and provided training in lean strategies and tools, conducting improvement initiatives across several lab departments. In long-term care, 4 new facilities are under construction. The department also scored over 73% in all 6 dimensions of the Experience of Care survey. In material support, product standardizations have resulted in savings and improved patient care. 114 new Pharma Health Pro contracts and 48 Med-Surg Health Pro contracts have been awarded. Key performance indicators have been identified, providing a focus for new initiatives. In medical device reprocessing, regional MDR technicians have been recertified in endoscope reprocessing. Policies have been finalized and are now available on the intranet, and lean initiatives have been implemented at the Health Sciences Center and St. Clair's Mercy Hospital. The Medical Officer of Health completed the Regional Health Status Report, participated in the St. John's Potable Water Contamination Emergency Exercise, and tracked outbreaks in real time. Medical Services started the Physician Leadership Program and have successfully recruited over 57 physicians this year. The Medicine Program has implemented interdisciplinary clinics within the HIV program to address wait lists, regionalized kidney and dialysis services, also eliminating wait lists and introducing pre-renal care to rural sites, achieved over 90% patient satisfaction, and decreased wait times and improved access to services in neurology, radioactive iodine treatments, and pulmonary function. The Mental Health and Addictions Program increased outreach services to community agencies, conducted renovations on the Psychiatric Rehabilitation Unit, West 2A, and the Forensic Unit, North 4B at the Waterford, and reduced wait times for a number of community-based mental health and addictions services. Morrison Food, St. John's Hospitals, implemented new bulk food service delivery model for the Waterford Hospital and completed renovations at Central Kitchen. In nursing professional practice, the acute care model of nursing is at St. Clair's, Carbonear, Buren, the General Hospital, the Janeway, the Dr. H. Bliss Murphy Cancer Center, and GB Cross. A pilot study on non-nursing duties was completed, and guidelines for assisting nurses with practice issues have been implemented. In occupational health, safety, and rehabilitative services, Eastern Health achieved Excellence Canada Level 2 Healthy Workplace designation. An integrated safety plan has been completed. A robust hazardous medication program was introduced, and the program introduced the Safe Patient Handling Project in long-term care. Pastoral Care and Ethics produced a multimedia resource tool for grief and bereavement, recruited members of the public for an Eastern Health Ethics Community Interest Network, and established pastoral spiritual care services in the Recovery Center. The Pharmacy Department has continued to provide quality service through a national drug shortage crisis. Susan Gladney Martin won the James C. Quick Award. Scott Edwards received a CEO Award of Excellence, and Jerry Peckham was the Allied Health Leader of the Year. In planning, the Trinity Conception Community Health Needs Assessment was released. The department organized a Board of Trustees partnership event on navigation and developed a community engagement framework. Protection Services merged regional security and health emergency management to create the Regional Protection Services Department, resulting in synergy, efficiencies, and refocused energy. The Public Health Department introduced Making a Difference, a breastfeeding training seminar for staff, and increased public immunizations at seasonal influenza clinics. In quality and risk management, over 1,000 health professionals have been trained on disclosure, and the department continues to work with the Experience of Care survey. In rehabilitation, continuing care, and palliative care, multiple program-wide patient education initiatives have been implemented. Palliative care services have been consolidated, and Learning Essential Approach to Palliative Care, the LEAP program, has been offered to approximately 153 healthcare professionals. Research and Knowledge Transfer completed a comprehensive evaluation of NAVNet. evaluated Voicera, and were funded to evaluate lost time injury prevention in long-term care facilities province-wide. In surgical services, the orthopedic central intake median wait time has decreased by 71% for our highest priority patients and 43% for lower priority patients. More than 3,000 new patients have been seen in this year, a 56% improvement in capacity. The program implemented a vascular disease risk reduction program and fully implemented the safe surgery checklist for all ORs in Eastern Health.
All you can say is, wow. You know, I sit at the executive table and, you know, we're all so busy doing our own jobs that we really sometimes lose sight of how complex this organization is and how much work is actually going on. And you see things like this that you just, it just is a wow. I mean, what accomplishments over this past year. So at this time of the year, we have our planning folks and our communication folks doing a lot of work pulling all this together, and it'll ultimately will appear in our annual report, which I think will come out in September, be presented at our annual general meeting, and it'll be in Connections magazine. So I really encourage you all to look for that and to share with all your colleagues the pride that we should have in this organization for all the accomplishments that we get in the run of a year. It certainly is a busy, complex organization. So now it's my distinct pleasure to welcome our President and CEO, Vicki Kaminsky, to present the CEO Awards of Excellence. Vicki?
Well, thanks very much, Oscar, and welcome to everybody that's here today and to everybody back at the office, keeping things going while we're here today. It's my pleasure to take this opportunity to talk to you a bit about recognition and about the value of the employees at Eastern Health and what you bring to our organization. We set aside time each year to acknowledge the hard work of the people that we work with and the many achievements of the organization like you've just seen. And I think that's important. It's vital to our health as a team, no matter what else we're dealing with in our day-to-day jobs. It's important to recognize, reward, and celebrate those things that we do very well. There's always challenges in healthcare. There's not a day goes by that we don't hear a challenge in healthcare. However, I know that together we can continue to focus on providing high-quality care, like you're doing, to our patients, to our residents, and to our clients, and we can be supportive to each other as team members. No matter what your job is, no matter what you do or where you do it, whether the public sees you every day or whether you're invisible to them, we know that you're there, we know that you're working hard on their behalf, and we want you to be as proud of what you do as we are of you. This year, we're encouraging you to adopt the fish philosophy in your workplace. And we're not hoping that you're going to start telling tall tales. That's one fish philosophy that works sometimes. But what we are asking you to do, we don't want you to open any cans of worms either. I mean, we have enough of those on open line. What we would like you to do, though, is to think about the fish philosophy when you're at work. And there's 4 basic principles. The fish philosophy says when you're at work, you need to be there. You need to make someone's day, you need to choose your attitude, and you need to play while you're at work. Pretty simple ideals, but very powerful when you think about it. So when we say be there when you're at work, what do we mean? We mean you have to be present in the moment. You have to be listening. You have to be attending and paying attention. How many times do we get distracted? Do we start to think about the next bed, the next patient, the altercation that we may have had at home before we left work, the bad driver we met on the road, an encounter that we had that we wish we could have done better? Being there means letting the outside forces that distract us from the moment go. Let them go. That's a challenge, to be sure. but it is also a recipe for a quality experience for everyone around you. Did you know that you can make someone's day? Your patient, your client, a family member, your colleague, a caller, a friend. You have the power in you to make their day. Help them out. Show them the easiest way to get where they're going. If someone looks lost, offer to help them. Answer their questions. Give them a hand. Sometimes the simplest action, the briefest smile, the smallest gesture will make someone's day. So here's my challenge for you tomorrow at the office. Don't pass any person without saying hello. Good morning. How are you today? See what happens. You might find that it makes your day too. And if you're me, it'll give somebody the opportunity to tell me what we're not doing right, and me an opportunity to tell them about all the things that we do very well. Just recently, someone said to me, you know, the happiest people are not the ones who have the best of everything, but the ones who make the best of everything. And how true that is. Choose your attitude. That means deciding what kind of mood you're going to be in today when you come to work, when you go home. No matter what's going on around you, just think about how good it makes you feel, even when you're in a bad mood, to know that you're helping somebody. That when you deal with someone who is pleasant, friendly, and focused on your needs, you feel better. Remember that. That's the kind of feedback I get most often about all of our staff. People are either upset because of the way someone spoke to them, or they're extremely complimentary about the person and said, you know, they smiled a lot. They looked like they enjoyed their job. They looked like they liked me. And finally, the fish philosophy says, play. So you're thinking to yourself, play? You can't be serious. I hardly have time to work. Obviously, we have very serious work to do at Eastern Health, and we can't be acting like fools in the hallways or like Oscar does once a year on the videos. But we do need to have that fun. I mean, that is some of the most fun that we can have, is when we take people outside of their own experience and start talking to them about the things that are important to us and important to them. This week is a prime example of play at work. I'm pleased to see fish walls and to read the shout-outs that are occurring. Carmel told you about one that came unsolicited. And that's the way to go. That's the way to do these things, and to hear about all the barbecues and the parties and the recognition events that we're going to be having. But we shouldn't limit it to 1 week. We need to do that every day. We need to come into work prepared to work. We need to come into work expecting to enjoy it. And we need to make somebody's day by bringing our attitude and our philosophy to work with us. Our goal with the CEO Awards is to celebrate the best of the best. And I hope that you will agree with me that today's recipients are worthy of this honor. In fact, everyone in this room is a winner. Every day, Eastern Health employees win the confidence of the public they serve, of the patients they're here to care for, and they do it in whatever way their job asks them to do it. They are winners every day. We are winners every day. And today what we're going to celebrate are those people who have won the trust and confidence of their colleagues. And as Oscar mentioned, no greater nomination than the one that comes from the people that you work with. So on behalf of the executive team and the team of individuals who evaluated the nominees for these awards, I would like to say how impressed we were by the many nominations received and by the absolute quality of all of the nominees you're going to hear about. After reviewing the nominations, I can tell you that I feel each and every one of you worthy of recognition, and I applaud you for your talent, skills, and abilities. And I'm going to say it's a pleasure just to be nominated, although you'll hear one of last year's recipients tell you it's really nice to win, too. So I hope she'll tell you that. So after reviewing everybody, we now have, we've had a tough decision, we've got them ready, and we've got the envelopes here to start to begin the awards. So we're going to begin with the nominee in the Leadership Excellence category. At Eastern Health, we need individuals who demonstrate strong leadership skills and capabilities. Individuals who are considered in this category are not only formal leaders, but informal ones as well. Our leaders promote the diversity of people and ideas, work-life balance, recognition, and teamwork practices. They are mentors and coaches, and they empower and support employees in all phases of their career. To help me present this award, I asked the 2012 recipient, Rick Singleton, to please come and join me here. So let's have a look at the nominees.
Patricia Rose, DI Manager Janeway, nominated by her staff for her encouragement, support, guidance, and open communication style. Gary Peckham, Regional Director of Pharmacy Services, who since 1992 has endeavored to get the most from his staff and has demonstrated strategic thinking and vision as a leader. Chris Power, Divisional Manager of Nursing and Clinical Support for Cancer Care, instrumental for overseeing many new initiatives for the program and for implementing the QPPE for nurses. Tracy Wade, MLT Tech 2, Biochemistry St. Clair's, a positive, hard-working leader who is dedicated to improving the medical laboratory technology profession and morale in her department. Krista Dawson, Social Worker and Clinical Team Lead in Long-Term Care. Krista excels at maintaining a sense of connectedness amongst her team and recognizes the uniqueness of all residents and staff. Joanne Dunn, Manager in Employee and Labor Relations, whose nominator described her as living the values and the employee promise through her day-to-day interactions. Sherry Penny, LPN, Interface Senior Citizens Home. Sherry is described by her nominator as someone who will not see herself as a leader, but who leads by example each and every day with her colleagues and co-workers. Sharon Daw, Coordinator for Volunteer Services, St. Clair's Mercy Hospital. Sharon is described as having influenced and inspired countless volunteers to reach their full potential. Melissa Mulrooney, Occupational Therapist and Team Lead, Occupational Health and Rehab, who shares her wealth of knowledge and encourages everyone to give their best effort every day. Merle Steele Rodway, Director of Infection Prevention and Control and Medical Device Reprocessing, nominated by her team as an outstanding role model, nurse leader, and patient advocate. Trina Hilliard, Community Health Nurse, whose personal leadership qualities and professional strengths have contributed greatly to the public health team. Karen Milley, Interim Director for Home and Community Care and Public Health, recognized for her accessibility, open communication style, and efforts to improve and transform her departments. Jeanne Robertson, Regional Director for Children's and Women's Health. Jeanne is described as a constant source of motivation and empowerment, who supports professional development and team success with her can-do attitude. Elsie Thistle, Team Leader, Center for Pain and Disability Management, whose leadership at a time of uncertainty and change has had a positive influence on this diverse team.
Quite an amazing list of nominees. And the winner is Jeanne Robertson. So I understand we're not the only ones who recognize Jeanne's leadership, and she's been asked to go out on a survey and offer some help to another facility, give some guidance, so she'll be surprised to learn that she won. And we have here Arlene, who's going to accept the award for her and maybe tell her. Here's her pin, Arlene. Here's her pin. And she's to give a 1-minute speech. So.
Okay. I know about 1 minute. Anyway. Hi, folks. Jeanne, I'm sure, will be very humbled by this award. She's a great leader. Unfortunately, she can't be here today. She's actually on the West Coast doing an accreditation survey. So I'll be sure to pass on her thanks and her appreciation to her, to all of you. And just wanted to say thank you again on her behalf.
Thank you.
Okay.
Thanks very much. Thanks, Arlene. Thanks, Rick. Okay, so the next category, a mentor is someone who advises, trains, or coaches other employees in such a way that motivates them to excel. Nominees in the mentoring category demonstrate a willingness to engage other employees and to seek to guide employees to achieve goals. To help me present this award, I ask the 2012 recipient, Scott Edwards, to please join me on stage. All right, so let's see the nominees.
Patricia Granger, faculty member, Center for Nursing Studies, who has continuously coached and advised fellow faculty members and other Eastern Health employees on their research endeavors. Judy Coffin, Quality Program Manager for Medical Services and Diagnostics. Judy has often taught us to look at things from another perspective, and she's always the voice of calm and reason, say her nominators. And Michelle Penny, RN, whose mentoring for the dialysis unit not only includes professional and clinical advice, but personal support and guidance as well.
Congratulations, nominees. And the winner is Judy Coffin. So Phil's taking pictures. We got to stop and pose. There we go. I'm going to try to get in the middle of you. Great.
Wow, I wasn't prepared. Just want to say thank you to my nominators, the lab quality team. They're a great group to work with, and as an organization, we should be proud to have them as part of our team. And they make my work pretty easy. And thanks a lot.
Congratulations, Judy. Thanks, Scott. Okay, so nominees in the innovation category have developed or implemented innovative ideas that resulted in a measurable increase in quality, efficiency, and productivity. These individuals created an original idea or uniquely adapted an existing program or process or concept which resulted in a long-term benefit to our patients, our clients, our residents, or to Eastern Health itself. To help me present this award, I would ask the 2012 recipient, Peter Barnes, to please join me on stage. Welcome, Peter. All right, so the nominees are
Colleen Jones Down, Clinical Physiotherapist 2, whose innovative work on reducing the incidence of plagiocephaly has been recognized by her peers provincially and nationally. The Pharmacy Ethics Drug Shortage Framework Team, Gary Peckham, Rick Abbott, Susan Gladney Martin, Rick Singleton, Jacinta Penny, Daryl Pullman, Jennifer Flynn, Chris Capozzi, and Doug Prince, whose efforts have received national recognition and praise. The Neurology Multidisciplinary Teams for Movement Disorders and MS, Drs. Alan Goodrich, Mark Stefanelli, Keena Squarely, and Sharik Mumtaz, and Janet Barber, Brenda Peddle, Janet Brown, and Denise Murphy, Jennifer Shears, and Ruth Wade, whose innovative ideas reduced wait times by hundreds of days and increased team satisfaction. Tom Casey, Senior Budget Analyst, who single-handedly developed and implemented the TM1 budgeting package, which streamlines the monthly and annual budgeting processes for the organization. Keith Keogh, Project Manager, and the Voicera Implementation Team, Sandra Gear, Amanda Whalen, Jackie Bromley, Julie Bartlett, Sandra Evans, Kyle Sampson, Sean Clancy, Chris Howell, Jonathan Locke, Peter Ivey, Dr. Scott Wilson, Susan Bonnell, and George Smith, who together were the first to implement this communications technology in Atlantic Canada.
Congratulations. And the winner is Tom Casey. Is Tom here? There he is. Great. Congratulations, Tom. We're going to get you to turn around so Phil can get a picture of us. Smile, cheese. Great. And we want you to say a few words.
I'd just like to say thank you. It truly is special to be nominated and honored by your colleagues. Thank you.
I don't know if Tom's married, but his wife's a happy woman, a man of very few words. And I have to tell you, if we ever have an award for Poet Laureate, it's going to be your nominator, Tom. So you might just want to see the poem that was written about Tom when the nomination was made. So thank you very much. The Safety Excellence Award acknowledges a commitment to safety at all times and in all work practices and workplaces. Nominees participate in training opportunities and show an understanding of safety practice within a specific workplace setting or on an organization-wide basis. To help me present this award, I ask the 2012 recipient, Scott Murphy, to please come forward. The nominees for the CEO Award of Excellence in Safety are
The Occupational Health and Safety Committee, Building 532, Barry Hewitt, Carrie Brown, Mike Ryan, Lori Yetman, Leanne Brinston, Alicia Varden, Scott Antle, and Susan Hutchings, who navigated staff working on this site through a major OH&S issue this year. Elizabeth Reelis, clinical pharmacy specialist, whose participation on numerous quality and safety committees and commitment to quality standards permeates everything she does at Eastern Health. And Kelly Spearns and Renee Dobbin, managers in home and community care, who together have been instrumental in implementing the working alone or in isolation policy, and also support OH&S committees in their work areas.
Okay, congratulations. Another tough choice. And the winner is OH&S Committee for Building 532.
I just won't be as short as Tom, sorry. I'll try though. Mainly, number one, I just want to thank all the members of the committee. It's only through their hard work that we were able to get through a major issue at Building 532 and actually come out the other side. So I just want to recognize Carrie Brown, Mike Ryan, Alicia Varden, you guys see the light here, Karen Singleton, Gary Burns, Scott Antle, Laurie Newhook, and also Susan Hutchins. I want to make sure I got everyone. Also, I want to appreciate all the guests. So also part of our committee, which is Barry Fitzgerald, Jessica Shepard, and Kathy King, because mainly it's all through this our committee that we were able to get through it. Who knew we'd actually become an expert in creosote, in testing of VOCs, understanding naphthalene and what the smell threshold is. But I think more importantly, as a committee, we joined together with the rest of Eastern Health. We worked with OH&R, OH&S, with the directors, the vice presidents. We had such a large people involved in this. We can't do this on our own. It's only as a collective we're able to overcome this task, understand what the issue was, come up with resolutions, and then move forth, all for the safety of the staff that's there and for the clients who are there. So my part, actually, I'm quite honored to be actually up here with them because they did all the work. I'm just here looking good. So what I'm trying to say is, it's not us that did it. It's the entire organization and the staff there and the belief that we could actually make a difference, and we did. Thanks.
Thank you.
Yeah, what to do with it.
Well, congratulations. That was excellent. So, building community capacity is integral to our success as an organization. Nominees in this category develop, manage, maintain strategic partnerships with other community groups, volunteers, and/or organizations to help better serve the population. To help me present this award, I ask the 2012 recipient, Nancy White, to please join me on stage. So let's take a look at the nominees in this category.
Tammy Greening and Sherry Kennedy, Eastern Regional Wellness Co-Chairs, whose work connecting groups strengthens the communities we serve.
And the winner is Tammy Greening and Sherry Kennedy.
We're very surprised. First, we want to thank our nominees for sending this in. We really appreciate their kind words. We work within the Health Promotion Division of Eastern Health. We're really fortunate because a large part of our role is co-leads with the Eastern Regional Wellness Coalition. And that's a network of community groups out there promoting wellness in their communities. Right now, we're working with over 250 groups. So that's amazing, amazing. And I guess community partnership is essential in the work that all of us do, and especially in the work that we're doing. And it's amazing to see the amount of work that's being done in communities. We see leaders every single day. And certainly, it's not just me and Sherry, it's our whole division. It's, we have a steering committee with the coalition. It's a partnership of a number of people. So we're not in this alone, but I do love working with Sherry.
I just want to let you know, because I think in Eastern Health, a lot of people may not realize who we are and what we do. I see us as a community arm of Eastern Health. We provide community grant funding to grassroots community groups, and we work with populations. So we may fund a family resource center to do a little chef program, or safe transport of children and a booster seat giveaway for families. Maybe we offer money to a seniors group who have some social events and include people in the community who are very isolated, and so much so that they have to get a cell phone so their kids can keep track of them, and they're so involved in that group. It's so satisfying to see those things, or to see a youth group to have a basketball net that they can use. And again, we don't do it alone, and it's just fabulous work. And Oscar, I have to say, I like the cut of your jib. It's great. And I know we're the only ones who are nominated, but I challenge you, there's so many people in this organization doing community capacity. We were shocked. We were in the line with our manager, Bernadette, and we realized we're the only ones in the category. But there are other people doing that work. So nominate and nominate and nominate, because I know there are tons of people doing great work out in the community. Thank you very much.
Well, thank you both very much. The Service Excellence category is intended to reward individuals who are a model and inspiration to other employees in their dedication to excellence in their work. Nominees must demonstrate outstanding dedication to their work while maintaining a high level of commitment to Eastern Health's vision and values. So to help me present this award, I ask the 2012 recipient, Charmaine Hearn, to please join me on stage. Charmaine said she'd help present this as long as she didn't have to give up her crown. So, could we see the nominees for Service Excellence, please?
Sandra Williams, Administrative Assistant. James McLean, Land Administrator. Dr. Wallace Ingram, Physician. Sharon Dominic, Nurse Coordinator, Bilingual Services. Marilyn Shea, Administrative Assistant. Rebecca Tobin, Clinical Pharmacist 2. Bernadine Moyles, Education Consultant. Wayne Keats, Cardiovascular Technologist 2. Steve Fitzgerald, Cook 1. Sherry Bugden, Staff Nurse, Cardiac Critical Care. Rosalind Clark, Food Services Worker. Madonna Phillips, Clerical Support Services. Wayne Stratton, Treatment Attendant. Kim French, Home and Community Care Nurse. Susan Hutchings, Administrative Assistant. Darren Bowers, PCA, Health Sciences Emerge. Lillian Barry King, Public Health Nurse. Ulrike Zuschlag, Prosthetic Technician. Bill Blackmore, Nurse Practitioner. Terry Chater, Database Administrator. Team Leaders, Medical Device Reprocessing. Helena Cadigan, Paul Fowler, Francis Kennedy, Jocelyn Price, Ivy Worthman, Viola Mercer, Ida Devereaux, and Suzette Blunden. Deborah Panton, Administrative Assistant. Sharon Leonard and Louise Tipple, Team Leads, Home and Community Care. Rita Tremblett, Domestic Worker. Linda Au, Care Facilitator. Brian Connors, Bus Driver. Gail Chafe and Jocelyn Martin, Diabetes Educators. Jill Taylor, Clerk 2.
Congratulations to all the nominees. And the winner is Rita Tremblett. It's a long way down, isn't it, Rita?
I would like to thank my nominees for nominating me for this award. I also will accept this award from all of my employees, all of my Eastern Health people that work with me in housekeeping and domestic. Also, thank you to my management who encourage me every morning when I come in with a smile to move further ahead. Thank you.
Thank you very much. And our final award this afternoon is the Team Excellence Award. Our largest group of nominees, teams are at the heart of everything that we do in healthcare. Last year's winner was the Janeway Lifestyle Team, Please join me in welcoming Team Representative Ann Wareham to help present this award. To be considered for this award, nominators were asked to think about the team's impact, innovation, expertise, dedication, performance, quality, reliability, customer service orientation, and flexibility. And I'm sure you'll agree with me that the following nominees are worthy of note.
The stem cell transplant team: Yvonne Gulliver, Stephanie Dyer, Kendra Rogers, Tony Moores, Joanne Ledrew, Charlene Downey, Dr. Thompson, Joanne Hickey, Pam Rudkin, Cheryl Hines, and Cheryl Pike. The dialysis team: Health Sciences Center. The Mount Pearl Square Zone 3 staff: Krista Stagg, Krista Fudge, Leslie Mason, Ramona Kellaway, Sarah Porter, Kelly McAvoy, Colleen Labonte, Michelle Wadman-Scanlon, Julie Sullivan, June Bursey, Nicole Howell, Donna Gillard, Melissa DeLeon, Pam Ryan, Cheyenne Comden, Brianne Burton, Trina Hilliard, Heidi Vokey, Gail Phillips, Jackie Kane, and Amanda Barnes. The Rehabilitation Day Services team: Dr. Jason McCarthy, Bernadine Yetman, Jen Shears, Lisa Hutchings, Verla Bernie Lekovich, Elsie Murphy Dowden, Kim Barron Squires, Airdrie Miller, Sandy Gamba, and Dixie Stone. The 4 North A Hematology and Oncology team and the Lean team: Christina Walsh, Stephanie Dyer, Tony Moores, Kim Adams, Karen Butler, Stan Flint, Elaine Follett, Gerald Howard, Elizabeth Kennedy, Dean McIsaac, and Justina Vaklavek. The HR Client Services Recruitment and Classifications Support Team: Melissa Lynch, Dean Stuckey, Jill Druken, Wanda Ricketts, Melissa Walker, Kim Crummy, Melanie Stringer, Wendy Coltis, Sandra Oliver, Heather Pittman, Carolyn Fagner, and Catherine O'Keefe. And the 7 West Stroke Team, St. Clair's Mercy Hospital.
Congratulations to all the teams. And the winner is Stem Cell Transplant Team. Come on down.
With speeches, I'll warn you. I thank all of you for recognizing the stem cell transplant program. I feel very privileged to work with my coworkers here. I've never worked with such a group of people that are so dedicated to patient care. Our team is composed of a large number of groups. We have the pheresis nurses who often come in on their days off to perform the stem cell collections. We have our laboratory personnel who are not here today, but ensure that the stem cells are processed properly and that we have adequate numbers and monitor our freezers even on weekends. We have our pharmacist, Pam Rudkin, and our social worker who, in our drug shortage, are ensuring we have adequate drugs and trying to finagle coverage for our patients. I have Charlene, my nurse practitioner, who is my extender and does a lot of my work for me during the day. I have my co-workers, Dr. Hickey and now Dr. Jones, to help with the patient care. And Yvonne, our coordinator, who really keeps us all in line. And also thank you for Christina for nominating us for this award and managing the program for us. I think our program is very important. Since 2001, our patients are able to get their care in the province, and prior to that had to travel to Toronto for their transplants. So I really thank the group for working together, and I think our motto is the patients are number one.
Thank you very much. So congratulations to all the nominees and to all the winners for the past 3 years, and in fact to everybody who took the time to come today, and for everybody who's looking after things back at the office. A big round of applause. I think we are all truly winners. So from scholarships in the fall to service in the spring and the CEO Awards of Excellence in the summer, we're kept pretty busy with a full recognition calendar all year long, and that's just the way it should be. Aside from Jose Duma and Renee Chater in HR, Susan Bonnell and the Corporate Communications team who support recognition, and of course the entire recognition committee, I'd also like to recognize the many individuals, the teams, the managers, and the directors who make special efforts each and every day to create a culture of recognition in Eastern Health. Formal programs like the Healthy Workplace Champions Program, the Good Catch Award, and the WOW program, as well as the annual Nurses Gala and the Allied Health Professionals Recognition Program, help keep the momentum going all year and everywhere. For me, recognition begins with the individuals. If you feel happy with who you are and proud of the work you do, then that will be reflected in the way others see you as well. I'd like to share a video with you that was developed for National Nurses Week this year. It was developed by a public health nurse, Trina Hilliard, and I love the pride that's on display in this video. So happy Recognition Week, everybody, and keep the videos and the good stories coming.
Well, what's left to say? We're very proud of you. Share the pride. And thank you to all of you for coming. I would like the recognition committee, the committee who put all this work together. Where are you? Why don't you come down here and do the red carpet trick? Where are you, Susan? Get your team down here. You know, these folks do a lot of work to put this together, and the real beauty of it is they love that creative stuff. It frightens me a little bit, especially when they approach me every year, but it really is a great team. Please give a round of applause to the team. Now, they tell me that this is going to be put on YouTube. That worries me a little bit too, but everyone's going to be able to have a look at this and share the pride that we all feel here today. So more to come on that a little bit later. So that's a wrap. Enjoy the rest of your week, rest of your day, and again, be proud of everything that you've accomplished. I'd ask the winners and the Innovation Award people if they'd come down to the front and have pictures done at the end before you all leave. So have a great day.